Thank you very much for all welcoming words. And let's proceed with our third panel, Financing of Sustainable TB Response. I'm happy to introduce chairs of this panel, Ms. Maria Kirova, Head of Department Asia, Europe, Latin America, the Caribbean, the Global Fund to Fight AIDS, Tuberculosis and Malaria, and Mr. Razvan Vulcanescu, Undersecretary of State, Ministry of Health, Romania. Please welcome, the floor is yours to lead the panel and invite your key speakers and panelists.
Distinguished Madam Regional Director, Honorable Ministers, dear colleagues. Before I have the pleasure of introducing our first speaker, allow me to start by congratulating the organizers for the initiative of hosting this event and for the elaboration of the Riga Declaration, which I believe will stand as a historic turning point in our common fight against tuberculosis. It is both a pleasure and a privilege for me to co-host this morning's panel with Mrs. Maria Kirova, who's played a vital role in the implementation of the Global Fund's projects in Romania with respect to tuberculosis, AIDS, and other terrible diseases. I believe that getting the political consensus at regional level that health represents one of the main triggers for economic growth and social development is vital. I also believe that when dealing with expenditures in healthcare, one should not think of them as expenditures, but rather as investments in our health. Furthermore, obtaining optimal population health is not the isolated responsibility of one Minister of Health, but the whole government. And since most threats to public health do not know any borders, it is not solely the responsibility of one country, but the joint effort of the governments at regional level to find ways of better solving common tasks together. So without further ado, it is equally a pleasure for me to introduce the first speaker of the panel, Dr. Hans Kluge, and I'd like to take this opportunity to thank him and to thank Mrs. Regional Director for the continuous administrative, scientific, and political support of the WHO Regional Office for Europe in Romania. Thank you.
Good morning, everyone. Dear Mr. Minister, colleagues from the Latvian Ministry of Health, dear Regional Director, Dr. Susanna Jakob, colleagues, ladies and gentlemen, let me first and foremost thank the Minister and the colleagues for a wonderful dinner yesterday evening. We enjoyed very much, and we gave also the opportunity to informally discuss many of the issues that were raised yesterday and today. It's very significant, in fact, that we have this event here in Riga under the Latvian EU presidency, where also a number of very experienced senior TB experts are originating from. I have been asked to say a couple of words on people-centered health system transformation to scale up sustainable TB control with a particular focus on financing. So that will be the focus, but I'm happy to answer any questions as need be. This is a slight reminder that we are all in the same boat, that tuberculosis and MDR-TB is not just an issue, a threat in the eastern part of the region, but basically a regional threat and even a global one. As was mentioned already this morning, if you look, for example, at the TB notification rates in low incidence countries, in the big cities, we see TB notification rates which are higher than any of the TB high burden countries, with runners, forefront runners, for example, as Birmingham and London in the United Kingdom, Brussels, Barcelona, etc. So we are all in the same boat. The good news is that we have solid policy frameworks where to start from in Europe. First and foremost, the Health 2020, the European Health policy framework, which was championed by our regional director and the 53 member states, which aims, looking towards 2020, to an improved health and well-being for each single individual in the region, through what we call a whole-of-government and whole-of-society approach. At the regional committee, they also decided that the collaboration with the other ministers will be prioritized to the ministers of education and social support, and also the ministers of finance, which is so crucial in our fight against TB and MDR-TB. The Health 2020 is underpinned by what we call universal health coverage, which is that everyone in the population should have access to quality care, equitable, without being pushed into poverty. And that also nicely links with the post-2015 development goals. In the regional office, we worked hard with the member states to operationalize this Health 2020 policy framework and universal health coverage through a three-pillar approach, an operational tool. And I'm showing here the example applied to TB control. We are starting with the first pillar at the left, which is the expected health gain. So we are looking in the national health plans what the countries have decided are the most important targets. We have put here the ones on MDR-TB, which are regional-wide, comes from the MDR-TB action plan. Then we look at the second pillar. What are the areas of interventions, the service delivery interventions, which need to be scaled up in order to reach the expected health gains? And you also see the different areas of interventions here taken from the regional MDR-TB action plan. However, even if those interventions are proven to be cost-effective, feasible, etc., we know that there is still no universal coverage of those. And that brings us to the third pillar, is looking through the lens of the health system strengthening, what are the different challenges according to the different health system functions. For example, on governance, we know that there is a large variation in public allocations to health. There is significant inefficiencies and waste in the health system. If we look to the service delivery, there is an overinvestment in many countries still in secondary and tertiary care, and underinvestment in the primary health care, even 35 years after the adoption of the Alma Ata Declaration on Primary Health Care. In health financing, we know that payment systems do not necessarily facilitate a reconfiguration of infrastructure and challenges managing the interface across levels. For pharmaceuticals, and this is going to be discussed, I believe, by one of the panel members as well, facing regulatory and capacity issues, reducing the access to MDR-TB drugs, and also quite some challenges on the human resources, like, for example, the primary healthcare training lagging behind. This is only a flavor, right, not comprehensively, but we applied this tool in a number of countries, which also fed into the development of a regional proposal to the Global Fund on health system transformation to scale up sustainable DRTB. This slide shows what we know, right? There is a reverse relationship between TB rates and the national income. Put simple, the less gross domestic product per capita, the more TB we have. However, if you look a little bit in detail, particularly at some of the big bubbles in the middle, we see that there is not always this reverse relationship. And this is where health systems comes in. Health system choices are important. There is not always this linear relationship between high expenditures on health or TB and improved TB outcomes. So it's a little bit more complicated. Health system reforms are complex. The way services are financed can be a catalyst to stimulate more efficient service delivery. And we know that in particular some countries of the Eastern Partnership also, there is still a high dependency on the external financing. With these overall messages, let's zoom in a little bit now. This is an overview of the public expenditures for health across the different Eastern Partnership countries. The source is the WHO Global Health Expenditure Database. 2 points I would like to make here. First of all, we colored the middle lines under each country in red, which is what we accept as the indicator of government commitment towards health. It is the public health expenditure as a percentage of the global public expenditure. With the Barcelona team on health financing in my division, we usually say 12% is a kind of a benchmark. In fact, OECD goes higher, goes up to 15%. And what you see is that in a number of countries, this proportion of public health expenditure as a share of overall government expenditure stabilized at, frankly speaking, a relatively low level in 2012. But there are also some exceptions, like, for example, Belarus and Moldova. The second main message here is that in all of the countries except Belarus, there is a very high private share of health expenditure, which is mainly out-of-pocket payment, which, of course, most of all hurts the poor and the vulnerable. This here is a bit of analysis we did, looking at domestic and external funding for TB. Again, what we see is that the picture varies across the different Eastern Partnership countries. The second message is that even with increased funding, both domestic and externally, over the last years, most of the countries still struggle to collect the revenues to implement the commitments in the national strategic plans on tuberculosis, which means there is still a critical funding gap. So international support remains crucial if, number one, we want to safeguard the hard-won gains which were shown in the inspirational presentation by the regional director, but also to make further progress towards 2020. So this external support is vital. Having said that, increased spending is not enough, because we know from the World Health Report in 2010 on universal health coverage that in each health system, whether European, Asian, everywhere in the world, there is between 10 and 25% of what we call waste in the system. So looking only to external funding is not the panacea neither. And here we jotted from the report the 10 most important sources of inefficiencies in European health system. As you can see, a lot of those are linked with, for example, the pharmaceuticals, but also the overuse or inappropriate hospital admissions and the long lengths of stay. Medical errors and suboptimal quality of care. We do not always talk enough about patient safety and medical errors, not only to have a good quality, but also as one of the main reasons for waste in the system. Health system leakages, waste, corruption and fraud, and also inefficient strategies and funding mix. And this is so crucial from our experience if the Minister of Health are talking to the Ministers of Finance. Yesterday at the dinner, I had the privilege to sit not only next to the Minister of Health of Latvia, but also the Deputy Minister of Finance of Belarus, and we discussed this issue in depth, that from his perspective, right, one of the, in fact, main tension between the Minister of Health and the Minister of Finance remains the absence of indicators for transparent use of the funds. And this is also what we hear if we go around the countries to organize policy dialogues with the Minister of Health and the Minister of Finance. In fact, when we went last year to Malta, the Minister of Finance was telling, similarly to what we discussed with the Excellency from Belarus, that for me, he told Hans, health is sometimes like a bottomless pit. So this is not good. And then when we discussed a bit further, we came to a conclusion that for a Minister of Health, it is possible to get more money for the health, but on the condition that the Minister of Finance first and foremost sees more health for the existing money. Now that I see I captured your attention, I will complicate the matter a little bit further. Right? Savings versus efficiency. This is also crucial, particularly not to disappoint your Minister of Finance. It does not mean if you work efficient that necessarily you will save funds And this is a framework we developed with the colleagues of the Barcelona office when we did a lot of work on the impact of the economic crisis on health and health system performance. So, at the top you see efficiency gains, at the left you see savings. The left upper box shows where you can have both efficiency gains and savings. For example, by reducing input costs through better procurement. Massive improvements can be done by better procurement, for example, working through pooled procurement. We see this also in Greece, where we are very active. Selective cuts targeting excess capacity or inflated salaries and cost-reducing substitution. This is what we call doing the same or more with fewer resources. However, at the right upper box, working efficiency without savings is also very commendable and very powerful argument to negotiate with the Minister of Finance that you need more money. For example, controlling spending through health technology assessment, investing in public health and prevention, very, very crucial, and a flagship program also under the Health 2020. Let's now look a little bit in detail at the current financial arrangements in the TB services in the Eastern Partnership countries. What we see again is a variety in the picture, but that in many countries, if you look at hospital financing, the input-based financing approach still prevails. Good news is that there are a number of countries really scaling up national reform efforts in financing, both in primary healthcare and the hospitals. For example, Georgia, Moldova, Armenia, which are moving forward at a national scale with case-based payments for the hospitals and capitation-based financing in the primary healthcare. But basically all the countries are in some stage. We discussed this morning with the Deputy Minister of Health of Ukraine also the ambitious and timely efforts to do similar financing efforts in Ukraine, where we're very eager to collaborate as well. Some caveat also, which we learned and the countries learned, is that if you go with case-based payment in the hospital financing, it can reduce the length of stay, but it can also incentivize more admissions and readmissions. So the message here is that we need to look at this country-specific and a bit into the detail. That's, for example, why in Armenia is taking a next step in the financing, combining case-based payment for hospitals with global budget and also performance-based payments in the primary healthcare. A next target for the financing in the TB services might be indeed, number one, to look at a mixture of financing, and that's happening in different countries, acknowledging that the financing is a very important catalyst with the service delivery model. Number two, we have to look wider than the national TB programs, because the applied payment mechanisms for the providers at the country level have a wider scope than the service of the NTPs. And this is a key message. The TB reform to go hand in hand with the health system reform. To give one example, in Kyrgyzstan, the country is very advanced after 10 years in the DRGs. In fact, are in what we call phase 5 of the DRGs. The TB service is catching up, but still only in phase 1 of the DRGs. So to streamline and to align with the broader health system effort is very important. We are going to bring to the Regional Committee in September a document on the main strategic priorities in health systems up to 2020 within the Health 2020. This is the summary, let's say. Why I'm showing this slide is basically to remind that even if financing is so important, and the session is mainly about financing, it cannot go alone. Success on reforms in countries learned us that we have to go with a comprehensive system thinking approach to transform the health service delivery, but also move towards universal health coverage, where health financing is key. But to do so, you need also 3 powerful enablers to enable a competent health workforce. Think of task shifting, right? Aging of the population, aging of our workforce. Difficult to attract also in the TB service younger people. So what can the nurses and the midwives do better than the medical doctors, right? Innovative medicines and technologies, and generating health intelligence so to help the policymakers to make evidence-informed decisions, and ultimately to be underpinned by management, change and innovation, because this requires a lot of transformational leadership. But it has to be people-centered with the involvement of the communities. I'm going towards the end of the presentation. With also good news that while this might look overwhelming, it has happened and it is happening already. And I would like to give the excellent example of the host country, Latvia, which was particularly bad hit by the economic crisis in 2008-2009. And Latvia reacted one side with major cuts, but also had the courage and the leadership to go for a parallel transformation of the health service delivery. Latvia prioritized primary health care, reduced a lot the excess capacity in the hospitals, while increasing daycare and home care. And these are some statistics really showing this. Also prioritized to protect the poor and the vulnerable and give focus to coverage of essential medicines. So it is happening if the leadership is there. Another example in the region is Turkey, which has moved tremendously the last 10 years to universal health coverage with concrete results. And the lesson here is also, it takes time. You cannot transform your health system or TB service just overnight. And Ministers of Health are often squeezed to do this overnight, also with external pressure. But it takes at least 5 to 10 years. Tremendous results on number of years gained in Turkey. Success was that they took a comprehensive approach based on a very good SWOT analysis with community engagement, the medical unions, and a lot of strong leadership. Very good results on financial protection. The proportion of households with catastrophic health expenditures really decreased objectively, and also a very increase in satisfaction rate in the public services, which is important because if the ministers are going for a transformation of the service delivery, they need not only political support, but also a lot of popular support. So the people have to feel a real change, not that everything is about structures and processes. How does it feel to transform? When we asked our policymakers, this is how it felt. So one picture is worth more than 1,000 words. It's like the little chap who has to push over the sumo fighter. And you need a lot of force really to make this transformation happening, pushing against the mountain. But if you have the right ingredients in place, it is possible to move the big guy. What are the key conditions? Establish a sense of urgency. Frankly speaking, with the crisis, this is there. I mean, we really have the urgency. Look for a powerful guiding coalition. Who are your powerful friends? You cannot do it alone. And again, the community is a very strong ally. Create the vision and communicate the vision. This is what we see also in many EU countries hit by the economic crisis, that the right things are done, but either the skills lack to communicate the vision, or there is just no time to explain it. Empower others to act on the vision also means some risk-taking and to acknowledge that mistakes will happen. Plan and create short-term wins. To have the popular support and political support, you need to go for some low-hanging fruit while you are pursuing the long-term goal. Consolidate the improvements and institutionalize the new approaches. The way forward, obviously, we are in the same boat, and that's why we are gathered all here. But we need a lot of political, sustained commitment to transform the service delivery through a people-centered focus and with community engagement, and to work together. Keep, for the time being, really the external support, while the countries need really to accelerate towards efficiencies and decreasing the waste. Finally, I would like to congratulate again the Latvian EU presidency for hosting really this milestone event, and we're very much looking forward to the next EU presidencies, like our region director was telling, the Luxembourg, Slovakia, to turn the outcomes of this conference really into a powerful council conclusion. Thank you very much.
Thank you very much, Dr. Kluge, for the very informative, inspiring, thought-provoking keynote speech. You have referenced Health 2020 as the platform and the framework within which we could reference and pillar our efforts to prevent and combat MDR-TB and to move towards ending TB in the European region. We have also noted your appeal to consider very seriously health sector transformation and to focus on the patients. This is also echoing what we have heard yesterday very eloquently from the civil society organizations, from Professor Kazachkin as well, in terms of making the health sector accessible, adapted, and acceptable to the patients. You've also outlined very eloquently the key areas which we need to look at more closely when we are discussing sustainable financing for TB, such as governance, service delivery, health financing, human resources, pharmaceuticals, and underscored the importance of really taking an integrated, comprehensive, systemic approach when we talk about the how part, about how we implement these reforms, about how we finance the future work in the TB area to sustain the gains and to make even further progress. Now, without further ado, I would like to invite the group of our distinguished panelists to the podium. Please, you can join us at the stage. And I will use, in the meantime, the opportunity to briefly introduce them. We have the pleasure of welcoming Mr. Ingus Alex, who is the Deputy State Secretary from the Ministry of Welfare of Latvia. Mr. Richard Bergstrom, Director General of the European Federation of Pharmaceutical Industries and Associations. Dr. Igor Perechinets, Deputy Minister of Health of Ukraine. Mr. Gheorghe Turcanu, Deputy Minister of Labor, Social Protection and Family of Moldova. And Mr. Maxim Ermalovich, First Deputy Minister of Finance of Belarus. As you can see, we have a diverse panel with representatives from different sectors: health, welfare, social protection, finance, all coming together at the crossroads for the future sustainability of combating TB and bringing it to an end in the European region. So we've tried to act upon the message for collaboration, partnership, and intersectorial approach in the TB fight. Now I'll move to the stage and join the panelists. As you all saw this morning, we are going to spend the next 1 hour talking about a critical issue, the issue of money, the issue of financing for our joint work. So it's the moment when yesterday we were starting and everybody was saying, well, we need to move beyond the words, we need to see actions, and we are looking forward to actions coming out of this conference, certainly. And as part of the discussions everybody was saying about how do we approach this, how do we make it happen? So the key question was how? How do we get the necessary level of funding and direction of this funding in order to end TB in the European region? This is the overall topic within which we would like to gear our discussion today. As Dr. Kluge was mentioning as one of his key points, is it only a question of the volume of financing? When we go and when we look for resourcing our TB efforts, usually we say we need more money. There is need for more money. It's always insufficient. And we will hear from the Ministries of Finance. We are sure this is a topic that they're quite familiar with. So my question is, with the money that we currently have, do we need to do anything differently? And if so, what do we need to do differently in order to achieve better outcomes, in order to move forward with the progress of our fight against TB?
Thank you. Es gan runāšu latviski, es ceru, ka tiek nodrošināts. I will speak in Latvian and hope that there'll be interpretation. And responding to your question, what we could do differently than we have done so far with the resources available now. When we at the Ministry of Welfare were invited to this conference, we had a brainstorming session to review what we are doing currently in the social sector, and most probably how we cooperate also with the health sector to confine the spread of tuberculosis and reduce the incidence of tuberculosis and to achieve positive results. And one of the things that most probably we would have to do differently, or that we would have to study, is the issue of what is a tuberculosis patient in specific countries or in Latvia. If we know the proportion of unemployed or the proportion of former prisoners, and then probably we stop at that moment because we don't have any other information about this person, whether this person is trained, why he or she is avoiding treatment, if he is trained to do a certain job, why he is not using the services provided by the state employment agency, why he is or she is not using other social services. So I believe this need is where we have to place the emphasis on, and the case manager probably has to be involved. If, for example, the social services find out about a person who has been infected or a family that has been touched by the TB, then probably the case manager has to be involved. But if this information is found out by the health sector, then irrespective of the personal data protection rules, a way should be found to transfer this information to the social services to try to create a rehabilitation plan based on individual needs, so that a person maybe who has not so much access to public resources would be given a way to achieve a positive result. Because we are moving from a general allocation of money to a specific sector to the emphasis on an individual, what resources we should center around this individual to solve the problem. This is clear, but then there is a question on how to do it, and then probably we have more questions than answers. And when I'm asked how, then I say that probably we have to sit down and discuss until we understand how we can do that more efficiently. I believe that this conference is one of such ways, so that sectors who work or maybe do not work together on a daily basis just sit down and discuss these things.
Very much. That was an intervention from our host, from Mr. Alex, from the Ministry of Welfare, Latvia. And we, as we said, we are starting a discussion about the different financing perspectives ahead of the TB programs over a time horizon ahead of us. And one of the areas that has been coming up frequently in the discussions is that public financing is channeled to the vulnerable groups and to the people in need through different sources and ministries, and the need of the social sector, of the welfare sector, teaming up with the TB control efforts has been emanating as a topic. Which has been highlighted by Mr. Alex. I would like also now to invite Dr. Perechinets from Ukraine, the Deputy Minister of Ukraine, to share his perspective on the question of what can we do differently with the current financing and resourcing for TB control efforts in order to be better, to be able to test, treat, and cure more patients.
Thank you. Well, the question is basically for the countries of the Eastern Partnership, and especially for us, for Ukraine, is very critical now, because the insufficiencies that we have in the system basically guide us what to do and how to do it. And when we look at the strategy that's been presented over these 2 days and the curve that we now have to remember that the 2050 is our ultimate date that we have to report to the universe what we've done in terms of the fighting TB in general, we have some key milestones that we have to put into our national agendas that we have to commit and to fulfill. For example, quite often in Ukraine we refer to TB and MDR TB services when we want to show the inefficiency of the health services in general, because all 6 pillars, as was perfectly presented by Dr. Hans Kluge, are very much interlinked, and if they are not appropriately addressed, we have all the health consequences we are currently dealing with. And for example, in Ukraine we have 22,000 of TB beds in the system. On top of that, we have 13,000 of TB rehabilitation center beds. So the infrastructure is humongous. The resources that we spend for the infrastructure are quite substantial, but at the same time, the results of the health gain from the infrastructure is very suboptimal. So, and also referring to some of the commenters and presenters, especially on the fact that during the economical crisis, we have to rearrange the system. We have to think out of the box. We have to find internal resources and to allocate them efficiently. Otherwise, or rely on the external funding, which is also very, the external sources are going to drain soon. So one of the options that we are currently considering is to, obviously, to move to the ambulatory model of care, which by doing so we can free some resources from the hospital services, and then reallocate the resources freed from the hospital sector to the primary health care. And potentially also we considering the national models to subcontract and contract community-based organizations that can support the primary care and community involvement to maintain the patients after intensive phase of the care from the hospital sector. So this very basic but comprehensive to extent approach for reallocating the resources or rethinking the financial strategies for the system, concentrating on all aspects of the process, from the primary prevention through the treatment and then back to the support, and carefully planning the needed resources from the national perspective. Again, using the available allocations are quite possible, provided that we are clear about the restructuring the system, providing that they're clear that the resources are limited, and we understand all the tiny details of the opportunities and needs that we have from the primary prevention and from the clinical perspective as well. Otherwise, we will not be able to prepare the system until 2020 at least, when we all expect that new technologies for diagnosis and treatment will be available. So we have to use this opportunity now to prepare the systems so the systems are capable of using new technologies and approaches. Otherwise, we may have a mismatch, as already been mentioned a couple of times here, that new treatment methods are coming, but the systems are not ready to use them because of lack of capacities, lack of resources, lack of infrastructure, and so on. So for us, it's clear that we have a very specific and context-specific milestone to prepare the system using the healthcare reform strategy that we're currently utilizing and using all the technical expertise we benefiting from, including the Global Fund. And for us, it's also important to note that facing the challenges that we currently have in terms of the economical crisis and conflict in the east of the country, we would need to have our partners on our side at least for the next 5 years while transferring the system, so the system can be efficient and prepared for the next level of the innovation in treatment and diagnostics. Thank you.
Right, thank you very much for all these comments.
If I may just jump in here, and after hearing the public sector and especially the different views from different countries with respect to the welfare issues, with respect to financing TB, I would like to invite our guest from the European Federation of Pharmaceutical Industries Association to share their view with respect to this. And I'm referring here especially to affordable pricing and their views on what mechanisms we need to look at to allow the countries in the region to access innovative technologies. And especially if they make use of the information that is available and if they use data mining in order to better tackle the steps forward with respect to tackling TB issues. Thank you.
Yes, thank you very much, and thank you to the organizers for inviting me. So I represent FPA, that's the research-based pharmaceutical industry, and maybe starting off by saying something obvious. I think the role of the private sector, the role of my companies is to develop new medicines and vaccines. That's obvious. But we also have increasingly a role to make sure that these medicines and vaccines are made available to people around the world. This is, of course, also reflecting the priorities agreed by all the governments of the world through the World Health Organization to go for universal health care. This calls for novel, creative mechanisms for improving access, including differential pricing or tiered pricing of medicines, which I'll come to. But first, let me just reflect first on the fact that we've actually seen over the last year or 2 years the arrival of 3-4 new medicines against tuberculosis. So we have bedaquiline from Janssen, we have delaminid from Otsuka from Japan. We have new uses and new regimens with moxifloxacin, that's Bayer, and we have now rifampicin coming soon to Europe also from Sanofi, which is for latent TB, a new combination. Now, that's good. That's very good. Okay? But it also, unfortunately, gives us a false sense of security that, pipelines are full. Now, it does show the commitment of at least some of my companies to the areas, and we will continue to do research, but, this has to be amplified and enforced. So I was not able to listen yesterday to Manika Balasigaram from MSF, but I'm sure that Manika talked about MSF's assessment of what is needed. And interestingly, coming from entirely different perspectives from civil society versus the industry, we make more or less the same assessment of what we need to do. There's a parallel here also to the area of antibiotics, where there's also a real problem with a shortage of compounds in the pipeline. But basically what you need to do is that you need to pool knowledge between private operators and the public side. You need to push through government co-funding of things, and I'll give you an example in a minute. And also you need some pull mechanism, that is that you have to make clear that there is someone willing to pay for this. Now, interestingly, as a side remark, on antibiotics, it seems to be that the pipelines are filling up again without having any big pull mechanism being in terms of advanced purchase commitments. Just the noise, just the political signaling to the industry that we are willing to pay for new antibiotics. And of course, in the United States and Europe, you can charge fairly high prices for a new life-saving antibiotic. Now, for that area, we now need to find access solution for the rest of the world, where there is no willingness or ability to pay. So we need this 3 Ps, the push and the pull and the pool. And we are doing some of that already. We have something called the Innovative Medicines Initiative. This is the world's largest public-private partnership in life science. It's a 5.4 billion euro PPP between FPA and European Commission. It started under the previous research program, FP7, is now being extended in Horizon 2020. Infectious disease is a high priority. We already have a 200 million plus program for antibiotics. We have a program, a small one, on TB called Predict TB, looking at assays and being better at predicting what works, essentially. Now we will pull together very soon a consortia for TB drugs in IMI, where we would do the pooling of the knowledge, and there'll be co-funding. My member companies will not get money from the Commission. The money is going to academics, and my companies contribute in kind. So that will complement the TB Alliance work. It will complement DNDi. It will complement other research that's being done. Now, turning to the access side, which is the main topic of this session here, I think we have demonstrated around the world that we can do things differently. We can have clever models, paying for performance, outcome guarantees, which may not be the most burning question here. I think here the burning question is to find the patients and hold on to them during the course of the treatments. And particularly the issue is going to be about finding the right pricing models for these medicines. Because whereas I think there is a growing acceptance for the fact that richer countries will have to pay more than poorer countries, and my companies are implementing these tiered pricing strategies for new medicines. What are you going to do where you have the challenge that actually most of the patients are in middle-income countries or poor countries? Which means that the volumes for my companies is not in the big countries. The volume is going to be in this region. So then we need to start working on differential pricing or tiered pricing. And it's a fact right now, and maybe this is the first time this is being said publicly in a meeting like this at least, is that for one of these products that have just been approved, the company has a much lower price in Latvia than in Germany. So the price of this product is a third in Latvia. Now, this works right now, but unfortunately because of some irony, whatever you call it, in Europe, that price difference will disappear over time because Germany refers to prices in other countries, including Latvia. And so do all other member states, excluding UK and Sweden. All others do price referencing, and they all refer to one another, which means that over time this is going to disappear, which of course is discouraging other companies from having differential pricing. So this is, I think, has to be high on the political agenda for particular disease areas like TB, that companies should not be discouraged from doing the right thing. They should be encouraged to do this. We need to make sure that these products are not exported, and we need to make sure that the Germans and the Swedes are from Sweden accept to pay more than Latvia or Romania for that part, or not to mention the Ukraine and beyond. So we are demonstrating commitment to continued research. We need to find new PPP models for research, and we need the help of the public side to enable companies to be creative and clever and responsible with pricing and access. So I look for political support, particularly from the European Union, and maybe we can get something out of the Health Council in April on this topic as well. Thank you. Thank you very much.
Thank you very much for sharing your perspective on access to new tools, to new diagnostics, to new medicines, and outlining again the common space, which in your terms, of course, is a common market. I would like now to continue the topic, because certainly political will we have heard very clearly as being an absolutely critical pillar for advancing the fight against TB in the European region. We have heard the same appeal for political will for the industry, and also the appeal for collaboration and partnership. So I would like us now to continue with the topic of collaboration and partnership, which was very strongly reflected in the lively discussions yesterday. And to go back to the meeting point of the health and social sectors, and use the opportunity that we have Dr. Turcanu from the Ministry of Labor and Family and Welfare in Moldova, and request his thoughts on how can health and social sectors meet together to improve the well-being of the TB patients and facilitate sustainable financing of TB prevention and treatment.
Спасибо. Я хочу поприветствовать всех участников данного.
Thank you. I would like to greet all participants of the present conference, especially the regional WHO director. Her presence at this conference testifies to the fact how difficult the question is, and especially how difficult it is to set up new programs. I started working in the field in 1983, when we worked a lot in the field of eliminating TB, and we reached the incidence rate of 34 to 100,000 population. But after the collapse of the Soviet Union, we lost our gains. But now, with the help of the WHO, we've started a new program to reduce the incidence rate in our republic.
On my way from the Ministry of Healthcare to the Ministry of Welfare, Social Security and Family, so the difference between our ministries is 54 meters. So joint work and joint effort, joint programs are not existing in our republic, and even on as regards analysis carried out on those serious cases, 50% of the TB patients are unemployed, who doesn't have, for instance, social insurance, who are not able to pay for medical services, etc. Other 50% are mentioned, consisting of vulnerable groups, for instance, drug addicts, those who are alcohol abusers, former prisoners, etc. And they do not have any social insurance and social support in our republic as well. In the last 5 years, the Ministry of Social Insurance has drafted a set or a pool of social services under the approval of the government, and we managed to have one common meeting in order to establish a joint ad hoc group between the Ministry of Healthcare and the Ministry of Welfare in order to draft and to elaborate all that case management, so that all those vulnerable groups mentioned would have the social support and social accompaniment. Of course, not only in other countries, but also in Moldavian Ministry of Finance is counting money, is counting finances, is looking where from that money could be channeled. And we will have one pilot project in 3 regions of our country. And I would like to request the WHO or the Global Fund, as we are not sure about costs of every medical or social service, how much particular items and positions of that program of social or accompaniment or case management would cost. Yesterday, our representative from NGO presented how much or what the proportion of homeless people is among their subordinates or their subjects requiring medical assistance as well. I would like to know experience of other countries in the particular project. As many people present here, I'm a doctor and physician myself, but about 57% of our population are not reacting and responding on the existing vaccine, and I presume that there is no assurance whether and confidence whether in the future the people would react and respond on a new generation treatment or medicine, etc. It's really important. Social support is crucial for preventing new cases of tuberculosis, and I'm not sure whether we are able to eradicate and eliminate tuberculosis at all in the future as well. It's really old and lasting disease, and it's really hard or almost impossible to eliminate it completely. But I really hope that we'll have new programs, new components included in the strategy by 2020. I am really grateful for sharing your experience in development for social insurance and social provision. so that our population in Moldova would be healthier and more protected against tuberculosis.
A strong commitment for Moldova, to integrate their social welfare support with the TB patients to ensure quick treatment for the patients, quality treatment, and successful treatment for them. So now there is a good opportunity, if there are good examples from other parts of the European region, to share them with our colleagues from Moldova. But before we open up the session for more questions from the audience, perhaps we take the opportunity to speak with Mr. Yermolovic, the first Deputy Minister of Finance from Belarus, to share his perspective on the sustainable domestic financing for TB control. We have all agreed that the domestic resources across the European region have worked hand in hand with international financing, including from international organizations, including from the Global Fund, to address the key challenges in the national TB responses. We have also noted the trends and the linkage between national income and TB burden. We also note that the trajectory for the future international financing for the region. So with all this background, it is going to be important to hear from the Ministry of Finance, that has been so frequently referred to in our discussions. What are their perspectives with regards to the focus and volume of domestic financing for TB control in order to sustain the programs and the gains to date?
Спасибо.
Thank you so much, dear colleagues. I expected that this conference would be more medical, and I feel quite uncomfortable in the presence of so many distinguished doctors and physicians, but after introductory motivating speeches on significance and seriousness of tuberculosis, issues of finance were announced and manifested as well, and we are discussing financial issues today at the panel discussion. Following my experience, I observed several important and significant factors capable of discussing. First of all, perspective to increase amount of financing for healthcare programs and the system of healthcare in general. I have several considerations here, and we must take into consideration the existing situation in the region, unfortunately disabling growth of national economies in the countries, and under such conditions, opportunities for increasing and raising funding for healthcare programs are almost zero, as other expenses and spending. Our countries undergo optimization or reallocation of state budgets for providing balance of their spending and revenue. Some aspirations and intentions are done in the field of restructuring and reallocation of financing to achieve the better efficiency and better results with the same spending or with a cut spending. We have discussed various opportunities for implementing new financing mechanisms and tools, cross-border international financing on the project concerning different programs for fighting tuberculosis, and situation in Belarus also coincides with the topics and issues discussed today and yesterday. There is one significant factor, key factor. When system of financing changes, there are transaction or transformation costs which increase spending on maintaining of two systems simultaneously. If we transfer from stationary hospital treatment to outpatient treatment, the Ministry of Finance must advance or pay in advance for those outpatient services provided. So additional funding and financing is required, provided by the Global Fund to the Republic of Belarus, so that during transition period those additional financial means would be provided for maintaining both systems for a certain period of time and to reduce domestic spending on the primary healthcare to outpatient treatment of tuberculosis in the country. Significance of such a tool or such cooperation in prevention of tuberculosis enables gradual transition of saved resources to more efficient mechanisms and tools. For instance, this year, in collaboration with the Ministry of Healthcare, we decided to finance additional food packages to be provided to TB patients, thus saved last year and adding to the financing provided by the Global Fund. So while and after transfer and transition to this new system, some more financial resources will be released for providing commitment of patients to their treatment. This is an issue of efficiency. Even in the case of saving some economic and financial resources, a better result is expected. As regards a general system for financing healthcare, healthcare in the Republic of Belarus is among top priorities of national politics. That is proved by the structure of state budget means allocated for the system of healthcare, and is also integrated in the economic growth program for the next 5 years. Even despite limited financial resources, the system and these priorities in the healthcare are maintained, and capital investment from state budget in development and expansion of the system of healthcare is maintained and preserved yet. We are planning, starting from 2016, to change methods of financing in general and national policy in funding spending, as well as in the field of healthcare. So minimum healthcare spending will be provided in the amount of 4% from GDP, having a long-term tendency and priorities of the country being set forth in minimum financing from the state budget, but approaches as regards actions of allocator of financial means will be delegated and will be enabled as regards the Ministry of Healthcare and municipalities, with the purpose to choose optimal ways and channels for financing particular spending. But for that effect, resources and spending would not be concentrated and focused on quantitative spending estimates, etc., but they must be qualitative, and they must be eligible for the system of healthcare depicting or illustrating performance budgeting. Especially representative. A really good example in that for fighting tuberculosis are among them, as we have precise indicators and key indicators One program has been completed. The next program for preventing tuberculosis is ongoing, and that allows us liberalizing channels of financing available for that program. I also consider, in terms of financing, costs in particular field is that efficiency of resources spending will be provided and maintained by centralization in the form of state procurement, especially and as regards medication to prevent or treat tuberculosis. It is provided and procured centrally on the level of a single contracting authority in the person of the Ministry of Healthcare to ensure procurement of the anti-tuberculosis medications for optimal price and spending. For instance, primary markets, less profitable markets are defined, and policy of procurement in every country, or actually of every municipality, it depends on the type of those expenses.
In the course of this conference, I was interested to hear that fighting TB, we haven't fully explored the potential of private-public partnership, which would enable us to find new sources of financing and promote progress in this field. And being a specialist in private-public partnership, I have to confess I have not come across any big projects in the field of fighting TB. I haven't come across any service models, haven't come across any standard projects, although from the point of view of an investor, such projects would be most interesting, securing sustainable, highly effective gain and low risks when it comes to return on investments. So here the state needs to assume responsibility for the realization of such projects, which can be implemented within the penitentiary system, and we may assume some models being realized in the European Union. So again, public-private partnership should be looked at as one of the elements of work between public and NGOs. We need to have clear-cut indicators to assess responsibility and to provide quality services for the patients.
Minister, being involved in PPPs myself, being the coordinator in the healthcare sector in Romania, I would particularly like to thank you for this last comment with regards to the possibility of using PPPs in order to tackle the issues of fighting tuberculosis. Also, as presented in Dr. Kluge's presentation, I think Belarus stands as a true example of how we can move forward, and it's a significant example when you have the Ministry of Finance on board and when they understand the importance of correctly using the funds available in order to tackle such issues as tuberculosis. I do agree that in the absence of indicators it is difficult to try and reason and find good solutions, but also in the absence of financing it's difficult to have outcomes. So it's important to meet in the middle. This is why I actually suggested at some point that the two ministers, the Minister of Health and the Minister of Finance in Romania, should actually switch places at some point, just in order to understand correctly the difficulties on both sides. Right. Before we take some questions from the audience, I would like for all of us to listen to the statement from the civil society on the Riga Declaration.
Good morning, ladies and gentlemen.
Good morning. Two of us will be presenting the statement because we are civil society and would like to keep the proper gender balance. We will be presenting this statement on behalf of TB Europe Coalition, which is a network of advocacy network of advocates and community activists that shares commitment to raise awareness about tuberculosis and increasing political will to control the disease throughout the region of WHO Europe region and globally. I'm Andrei Klepikov from Alliance Ukraine.
And I am Anita Artunyan from Armenia and representing Positive People Armenian Network.
Honorable ministers, ladies and gentlemen, colleagues and friends, on behalf of the TB Europe Coalition, regional network of civil society organizations, community representatives and advocates, who all wish to see an end of suffering and death from TB in our region. We would like to wholeheartedly congratulate and commend the Latvian government for showing true regional leadership for hosting this hugely important ministerial conference. Today we are at a critical juncture in the fight against TB, MDR-TB and HIV. Political commitment at local, national, regional and international level is urgently needed if we are to successfully tackle these epidemics in our region. With concerted and coordinated effort from the governments of Eastern Europe and Central Asia, EU member states, the European institutions, Global Fund to fight AIDS, tuberculosis and malaria, civil society, communities and technical partners, the battle against this epidemic can be won. And yet, in many cases, real political commitment has been lacking. If we continue on the path of business as usual, we will face a catastrophic increase in both number of AIDS cases and further spread of drug-resistant TB. Just last week, we heard the independent review on antimicrobial resistance launched by David Cameron. This predicts that if we do not make concrete political advances against drug-resistant TB today, by 2050, 75 million people could be losing their lives to drug-resistant TB at a cost of 15.6 trillion euro to the global economy, the equivalent of the entire annual economic output of the EU. Now, more than ever, it's time to take ownership. It's time for you to show that there is a true political commitment across Europe in tackling TB. In the coming year, far less international support will be available from external sources to help us to get rid of TB. Even with the current financial support, we are still faced with the funding gaps. So we need to be prepared. Together, we must develop sustainability roadmaps to address the decrease in international donor funding to the region. Only a concerted effort from multiple partners at country level can ensure effective and sustainable transition to domestic funding. It's critical that this opportunity is expressly seized by political leaders and donors. We need increased financial support for TB R&D and new and innovative research models if we are to reach elimination. We need to secure the access of patients to treatment by challenging high costs of diagnostics and drugs. We need to back up health workers fighting the disease every single day, risking their own well-being. We need to do things differently.
It is only by working together that we can turn the tide against. The involvement of civil society and communities is key. Our region is still very much looking at TB only from a scientific, technical, and medical perspective. This is just not going to cut it if we want to address the spread of drug resistance. As we heard today and yesterday, TB cannot only be seen as a health matter. TB is a multi-sectoral problem. The social, economic, and political aspects of TB are equally important. We need new approaches and new investments. As civil society, we are here to help address the social dimension of TB. We are the link. We are the bridge between the medical and the political response to TB. We, civil society organizations and community representatives, former patients, advocates, activists, and individuals are here to help. We have a reason to fight. We know our communities. We know what the realities are on the ground. We are allies, and only together, in partnership, we will succeed. Today, we are immensely disappointed that the EU Health Commissioner, Mr. Vytenis Andriukaitis, did not honor us with his presence. This sends a weak signal of regional leadership in the fight against TB. We would like to congratulate the ministers and deputy ministers who are here in Riga today and would like to offer you our support in defeating the epidemic. Civil society would like to call on those countries hardest hit by TB, MDR-TB and HIV in the region to reform health and financing systems to allow for smooth transition to patient-centered TB care with special consideration for affected communities, urgently to develop clear plans for sustainable TB and HIV financing and scale up beyond current donor funding. Continue engagement with civil society and affected communities to ensure sustainability and accountability of programs. We call on EU institutions and EU member states to drive the regional political response to both epidemics by developing a political plan of action on TB and HIV together with neighboring countries and prioritize TB and HIV in their political dialogue with the most affected countries of the region. We call on the Global Fund to ensure sufficient support for countries undergoing the transition process and to continue to support civil society organizations working with affected communities and vulnerable groups regardless of the transition process. And finally, we would like to call on all of you and Mr. Piebalgs, chairman of the conference, to reflect these recommendations in the Riga Political Declaration. Thank you all very much for attention.
Thanks to TB Europe Coalition for their statement. And we take the remaining couple of minutes and we give now the opportunity for some questions, comments, thoughts from the audience. Anyone? Voila, we have 2 people interested in this corner of the room.
Thank you. I'm Knut Landor from WHO headquarters, the Global TB Program. Thank you for a great panel discussion. I was particularly encouraged to hear the discussion about the need to look at funding TB across the health and social sector and beyond to address this social disease. And my question to the panel is, when you look at the budgeting needs, especially to address the social elements of the disease, to what extent is it known in each country what the social and the financial needs are from the patient's perspective? I think the primary focus of assessing the funding needs has been looking at the medical costs. But what are the costs in terms of, for a patient, the social cost and the income loss and the non-medical costs in terms of transportation costs, food costs, etc.? Is it known? Has it been documented? And if the answer is no, I have a little bit of a proposal for you, because 2 weeks ago in the WHO headquarters we had a meeting to develop a generic protocol for studying patient costs. This is linked to the global strategies, the End TB strategy's goal to achieve that no TB-affected family is experiencing catastrophic cost. So we need to measure that, but that tool that we're developing is also a tool to understand what types of costs patients are facing, which we know are barriers for getting into care and to staying in care. And it can also demonstrate what kind of social support and financial support is needed for patients.
Alex, you're going
Jā, man jāpiekrīt, ka īstenībā.
Yes, I have to agree that these costs contribute a significant part. So we have to remember that these people face not only medical costs, but also additional costs that probably have to be covered by public resources. But most probably the situations differ. The more vulnerable the person is, the more he or she is entitled to support from social systems, which we also have in Latvia. And this support depends on the assessment of the individual case, like income testing. Of course, in situations when people are socially insured or who has been part of the labor market, most probably they will lose more as to the loss of income from employment if he or she falls ill with TB. As I already mentioned, when we plan the public finances, we have to look at the individual circumstances of these people. And when we prepare the public budgets, we have to see what things that we probably currently don't even relate to the TB. But if we speak about TB patients, then these costs would have to be covered. For example, rehabilitation costs, maybe some employment costs and so on. And if we looked at these things, then the picture would be quite different, because currently we concentrate on medical costs and forget that this person will probably need some psychological or social rehabilitation, or maybe some other social services or other forms of rehabilitation, so that this person returns to his or her usual environment even after lengthy treatments. But we have to create several target groups because they could differ. Another thing that we should not forget is that employers should be involved in this process, because when a person develops a TB, most probably the employer has to be informed as well on how this job could be preserved, because as we know, the treatment is very lengthy, and this would prevent the person from actually working. But it is very clear that we have to look for the resources that we already have. We have to reallocate the existing resources, and we have to understand where to place them better.
And I would also urge to, for sure, involve also the communities, the NGOs, when determining and looking at the possible needs and patient costs when it comes to this larger type of assessment. Was there a question from Moldova, or voilà?
Good morning, everyone, and I will have a question for the fantastic panelists we have today, but first of all, please allow me to make some comments on the topic of, I know we are on the time, I will try to be short. So first of all, I would like to reiterate the commitment, the national commitment Moldova has that my colleague from the Social Protection Ministry just has expressed in his speech towards TB control at the national level. And this commitment is reflected indeed on the efforts the government takes during the last years in terms of financing the TB control programs. And if we express this in the type of the services, today the government already allocate resources for such basic services as diagnostic, treatment, the whole line, or the first line of the treatment is uptaking the second line of the treatment. We also allocate funds for the social support of TB patients. And we advanced in establishing mechanisms to pay our NGOs for the work they do provide in the communities. At the same time, we would like to acknowledge the donor support still our country receives from the Global Fund, but also the political advice and the technical assistance from the WHO, because all the innovative models we are trying to apply at the national level, they are supported by the analysis the WHO and recommendation WHO provides to us. There are several national local contexts to be considered, and perhaps some other countries do face the same challenges. And here I refer to the double burden of disease Moldova is facing. So we face considerable rise on NCDs, non-communicable disease. At the same time, the burden of infectious disease such as TB and HIV remains very high. So here is the greatest concern to prioritize and to focus indeed on health strengthening and health system strengthening, and not only very specific vertical programs we do still have in place. The second particular aspect would be the migration factor largely affected, and also some of the countries in the region facing kind of not under the control regions as Transnistria in the national level. So please, I will go forward right now on my question, because I see you pushing me, but my question would be on a very critical period Moldova and other countries are going through now, and I'm referring to the transition period from the donor support to the government level. What would be, from your perspective, from all the stakeholders and organizations you do represent, what would be the critical aspects to consider during this transition period in order to make it smoothly, and what would be the aspects to ensure at the national level in order to be able to maintain all these services developed before, because it is related, very much related to sustainability. So the sustainability aspect during the transition period.
If I might just very quickly jump in and ask and invite everyone, if you have any more questions, to address them during the coffee break to our distinguished panelists this morning. And I think, Maria, this is a question that was addressed to you, and I think it's an opportunity for both of us to draw some conclusions. Thank you.
Thank you very much for the question. Indeed, it's a good opportunity. I think I'm not going to share anything revolutionary with you. It is really the key points from the numerous discussions we've been having during the first day and this morning. So I think what it has become very clear is, as during this transition period, we need to make sure that the stepping stones and the systems changes and enhancements have been catalyzed in order to enable continued progress in the fight against TB with or without international financing. So what is clear is that there is funding for the TB in the health sector. What is important is the direction and the focus of this funding. So as part of the ongoing engagement of the international organizations, we all work indeed in a partnership, and our focus is towards directing the funding in the evidence-based interventions. The second point that I think we should use the opportunity over the next couple of years is to focus on the TB health financing reforms. The Global Fund is providing funding for TB programs in the Eastern Europe and Central Asia region, and it comes with the requirement that investments are going to be put forward in the TB sector provided that there are reforms in this sector. We cannot, and no one here in this room is ready to provide investments for hospital-based infections, for instance. We are going to support the move from the bed-based financing to ambulatory treatment and care. We are supporting the payment for results versus the payment for activities, as we were hearing from the honorable ministers and deputy ministers. We are going to support, and we need to work together on synergies with the other sectors targeting vulnerable populations, such as the support for treatment adherence, pensions to TB patients. I would like to mention the need for changes in the legal environment, which has been also highlighted yesterday. We would like to support, and that is an active part of the ongoing programs, and I think the dialogue will have to continue on the social subcontracting of the NGOs. The fight against TB will not be successful unless we have the communities involved at the right time in the right place. And I would like just to say that this conference is providing a very good opportunity for this work on the sustainability perspective for TB financing in the region. We're looking forward to the outcome of the conference, a resolution from the Council of Ministers on TB for the Eastern Partnership. So with this, I would like to conclude. Thank you very much.
Thank you. Thank you, co-chairs, for an excellent moderation, Dr. Kluge for inspiring presentation, and all panelists and speakers. Unfortunately, we need to stick to our agenda because we have three very important things to do during this coffee break. Firstly, it's coffee break, 45 minutes, so be back 11:45 for a very special moment. Secondly, now all heads of delegation, chairs, speakers and panelists are invited just outside for family photo. And finally, I would like to invite Dr. Belevich, Dr. Jakob, and Mr. Ryan and Timur Abdullayev, and all, of course, interested persons to the press conference at 11:15. It's just across the hall in press conference room Baltic. So now, family photo for heads of delegation, panelists, speakers, and chairs just outside, and for others, coffee break and press conference 11:15. Thank you very much.